why local anesthesia is important and essential. So how much important something is, to understand that you have to think from one single point of view. If it is not there, how much it will impact your life. See, you are wearing a watch. How much essential the watch is to you. If it is not there, can you manage life? You can absolutely manage it. You can use wall clock, or you can see cell phone. Sunlight. Okay, so to know whether something is essential or not, think from this perspective. If it is not there, can you manage? If you want to buy something, really want to buy something, think for a moment. Can I live without this for another few weeks or few months? If you can, then live. What is the problem? So, LA, think about this. Can you run the practice without LA bottle inside your clinic? All work will stop, except some filling or scaling. All work will stop. So that LA is helping us and the patients to get a good treatment without any pain. Imagine life without local anesthesia. If something is not there, only we will understand the importance. When the full mouth patient comes, when everything is ready, suddenly people are telling there is no LA bottle available. So what will you do? You cannot do anything. You might have all the technologies. Okay, so in that way, local anesthesia is very much important. So having a LA bottle and a syringe doesn't mean you can achieve painless treatment. It is not like that. You should know the technique. You should know the technique. You should know the anatomy. So when I tell you should know the technique, is it important? You should know the technique. Is it important? No, it is not essential to know about the technique. You should know the anatomy first. You should know the anatomy. Anatomy of the bone, anatomy of the foramens, anatomy of the nerve, anatomy of what the nerve is supplying, which areas. Blindly doing some technique is not advisable. We see somebody giving infiltration, we see somebody giving palatal infiltration, we see somebody giving inflammation. No, then we are also, oh, here I have to poke, I have to go, I have to push something, push to ml. Sometimes it may work, sometimes it may not work. When it is not working, you don't know why it is not working, right? Right or wrong? So without understanding the basic anatomy, we are giving anesthesia. Without understanding the nerve and all. Okay. So the first thing is we should know the anatomy, and then technique automatically comes. You don't have to read technique. When you know this is the switch for fan, you can go and put the switch there. What is that? What is the need to learn technique? If you don't know which switch is for this fan, which switch is for this light, then how will you manage? Okay. See, from the brain, cranial nerves are coming. 12 cranial nerves are coming. One cranial nerve is essential for us, and even in that one cranial nerve, only two divisions are important for us, right? Maxillary and mandibular. Skull is a bone, no? Inside brain is safely situated. From that, the brain sends wires, cranial cables. It has to come through some holes. Those are called foramens. So can you give anesthesia going inside the brain? It is not possible. Only when it is coming outside the foramen, you can. That is the concept. If you see all the techniques, majority of the techniques, they aim at the foramen. If the foramen is very much superficial, it is a easy technique. The foramen is very much deep, like inferior foramen, it is difficult. Infraorbital foramen, mental foramen, incisive foramen. Sometimes there is no such prominent foramen, it just comes the final nerve. It means you are giving posterior superior nerve block, anterior superior nerve block, infiltrations. These are all not foramen related, right? If you study in the aspect of foramens, it is very easy. If you know where to locate the foramen, you can go from this direction, any direction you can go. You don't have to follow the strict textbook. If you understand the anatomy, if you understand the logic behind the thing, then you can write your own technique, right? So the importance of local anesthesia is without it we cannot run it. We cannot. The patient can't get a painless treatment. You cannot provide a painless treatment. So in that way, it is very essential. Imagine you may know root canal. You might have went to a root canal course. You may be loving root canal. You will go to some root canal course. If the anesthesia is not proper, and if the patient will be holding your hand, I am in pain, you cannot do root canal treatment. You may be a good extraction specialist, but if the LA is not properly working, how will you do it? You may have technology, you may have skill, but if the LA is not working, how will you do it? So, proper technique, achieving success, and if you are experiencing failure, you should know how to manage it. So, this is the first importance of local anesthesia. What is the second importance is? What is the second importance? It is completely against the first scenario. Most of the complications, the emergencies in dental office are related to LA. Have you seen patient going into syncope? For a patient who you don't give LA. Patient coming for scaling and he is going into syncope. Patient coming for some CSD and he is going for syncope. Have you seen one patient smile designing? Only after giving local anesthesia, medical emergencies, complications come. More than 90% of the complications, medical problems happen only after you put the lignocaine with the adrenaline into the patient's systemic system, because it doesn't stay here. You understand the logic? It doesn't stay here. Only certain molecules go and attach with the nerve, sodium channel blocking. Okay, but majority they goes into the bloodstream and they reach in each and every system: heart, kidney, liver, brain. And when it combines with the fear of the patient, okay, when it combines with fear of the patient, complications are bound to come. When it combines with anxiety of the patient, complications are bound to come. So when you are giving LA with adrenaline, when a medical emergency comes, not only the LA is responsible. You have to understand this. Not only the LA is responsible, not only the adrenaline is responsible. Patient's fear and anxiety is also responsible. The more the patient is having fear and anxiety, the more risk for problems. You might have seen many times patient comes with a big gym body. They're asking, do you have any fear or anxiety? No, you'll be telling. But immediately after giving LA, you will go for syncope. You are not given any overdose. You have aspirated properly and you are giving the medication. The main problem is high level of anxiety and fear. Fear and anxiety you cannot see like this physical thing, right? Like this phone, you cannot see this. But it produces stress hormones inside the body, right? It increases the heart rate. Though you may not see the fear and anxiety, stress visibly. If somebody is telling, I am stressed, can you show the stress? Can you show it? Can you show your fear? Can you show your cell phone? You will show your phone. But can you show your anxiety? It is an invisible part, but it produces physiological changes. When you are walking in the road, suddenly some dog is coming, trying to bite you. Immediately you are getting fear and you are getting heart rate increased. Heart rate padapadan adikudala. Without LA, without adrenaline, your heart is pumping. When LA is added with that, then problems are bound. So these two things you have to keep in mind when you are giving anesthesia. First thing is, I have to achieve a successful anesthesia so that the treatment will be painless. Because the moment when the patient is feeling pain during the procedure, he is losing trust, he is getting more stressed, he is losing confidence over the system, over the doctors. right? Again, you have to give LA. That is not a pleasant experience for patient, for the surgeon. Okay. Second thing is avoiding complications with LA. So, how to avoid complications with LA, medical emergencies? That I will describe in short. There are two aspects. One is medicinal aspect, how much you give, whether you aspirate or not, how, how much total you are giving, how how are dividing the doses, how are dividing the treatment procedure. For example, if the patient is having upper and lower full mouth, if you give both upper and full mouth early at the single time, systemic toxicity will happen. So give LA for 1 hour, then finish it, then wait for some time, let the body level, no blood level of LA comes down, then you can give. Yesterday there was one very lean patient, very lean now, only 40 kg. So we have to handle the patient very much carefully because when the body weight is very less, immediately the toxicity comes. For Aditya and all, you can give any number of LA because she is weight, lot of fat will be there. All LA will store in fat tissue. But when you are treating a lean patient, you should be very careful. So yesterday when we finished the one job, we waited some time. Intentionally we waited some time. Then we gave LA. I told the doctor also, don't over give the LA. Just give one syringe. If necessary, I will give later. Don't pour LA and bath the patient in LA bottles. Okay. So to achieve successful anesthesia, we give too much LA. That you should not do. So how to avoid the complications? One is by proper administration, dosage, considering certain factors. This what are the factors to consider? Age. For a small baby, you should give. Or for a old patient, you should give accordingly to the age and weight. Weight is the important thing. Another important thing, what is the medical problems the patient is already having? If the patient is already having some cardiac issues, bypass done few years back, then you should handle very much carefully. Right? We should not overload it. Aspirate properly. Aspirate 2 times. Rotate the syringe and aspirate again. When you aspirate, don't give. Just rotate again and aspirate again. You know why? If not, read the book. Okay. And after giving 1 ml also, again aspirate. I usually do that. After giving 1 ml, I won't give 2 ml fully if I'm giving block. I will aspirate once again. And when you are giving, for cardiac patient and all, keep your eye on the pulse oximeter. Immediately you will see some changes. Suddenly, immediately for some cardiac patients. So having a pulse oximeter is also essential during LA. Because LA is the factor which causes medical emergency. Okay, we think only during surgery pulse oximeter is essential. Why during LA? So during LA itself you can. During LA itself you will observe the oxygen is shifting to 95, 94. Patient Aditya Patra. So having a pulse oximeter is essential. So age, weight, and then
medical.
Already what patient is having a medical, and what is already medical history. Previous LA, what is the experience? At the time any complications, at the time any issues. Apart from that, patient has taken food or not?
Sleep.
Sleep. Okay. So the food and sleep are very much essential. Because extraction LA and procedure, even coming to dental office itself is a stressful procedure. The body glucose is getting reduced. When you run, the body glucose it is getting reduced, right? You are burning glucose. The same way when the patient comes to dental office, when he is fearful, when we are giving an administration, the body blood glucose. So the patient should have good meal. Many patients they think that I may vomit, so they won't eat and come, or they may eat very little, 1 or 2 idlis. So asking food history is essential because hypoglycemia adds increase the risk of complications. LA, stress, hypoglycemia, sure shot you will go for a syncope or epileptic fits, seizure attacks. It is not fits, it is not epilepsy, but going into hypoglycemia, patient will throw the hands. Okay. Have you seen? No. So that is why having a, this is essential. Glucose monitoring kit in during the surgery is essential. Immediately when the patient is feeling drowsy, apart from checking oxygen level, heart rate, pulse rate, immediately check the glucose level also. Immediately you will get a diagnosis. Okay, the patient is having hypoglycemia, we have to address. If it is not there also, no problem, just give glucose. Even if you are not measuring blood glucose, immediately give glucose. Because going into hypoglycemia is a serious emergency. The patient is going into hypoglycemia. If you are hungry, what symptoms you will get? Severe hungry, no?
Headache.
Headache, you will sweat. So you have to look for the sweat. When the patient is sweating, then some complications is coming. Immediately you have to adjust the chair position, stop the procedure, give some glucose, speak with the patient, check the heart rate, raise the leg level, whatever it is. Okay, so this is very essential. Even if it is not there, no issues. Keep glucose nearby. Is it nearby here? If it is not, they just arrange it. So the glucose should be nearby. Imagine the patient has lost consciousness and is going to hypoglycemia. It is an extremely medical emergency. You cannot give glucose orally also. It happened once. Then you have to give IV. You should know how to give IV. So it is better to prevent these complications than to trying to manage them. Simple thing, ask history whether you have taken the breakfast, taken food or not. So food and sleep. Sleep is also essential. The patient is not slept yesterday night. Many patients, they are not sleeping the day before the treatment. Why?
Fear.
Because of fear. One patient told, I have been browsing the implant videos yesterday till 1 o'clock and I was. Have you learned implant, madam? I asked. Sometimes I will say, same pinch, madam, I also didn't sleep. I was also thinking how I am going to do surgery. During giving appointment itself, you have to tell. Don't think about surgery and don't awake in the night, sleep. Otherwise, you can give one listing before the surgery day itself. But one problem is they might oversleep and they may come for the thing. Okay, so this is one aspect. And some patients, they travel through bus or train and they reach here morning. Those patients also complicates. Yesterday morning patient, full mouth patient, we have taken scan and all. She became very uncooperative, restless because she didn't sleep. We advised the patient to reach Chennai by night and to sleep in the hotel and to come to the clinic morning. But what the patient told, ma'am, we have found something called red bus. People told that we can sleep during traveling also. I will come in that. So morning I asked the patient, have you slept, madam? No. If you're regularly coming, sleeper bus, you can sleep. But first time, how will you sleep? It will jump and down. So trying to sleep, in the train or bus, it won't work out. See, when the patient has not taken food and he has come to the appointment, you can give some food, get some idli. But if the patient is not slept and is coming, can you give? You cannot. Whenever the patient is telling, I didn't sleep properly at night, I think I always prepared for some problems. Okay, so this is one segment. And the second segment is how to minimize the medical emergencies with early I am discussing. The first point is with early the technique, age, medical issues.
Weight.
Past history of
Past history, then
Weight.
Weight,
Sleeplessness, food.
sleep and food. Okay. Then the second thing is fear and anxiety and stress. How much fear they are having, how much stressful they are having, and how are you going to manage. There are two ways to manage the stress and anxiety. Sometimes they just need some positive word from you, that's it. Don't worry, madam, we will take it. Okay. They are expecting that first. Don't worry, we will give you a painless anesthesia. There won't be any pain. Don't worry, we will take it. We will do slowly. Anything you just tell us. Any pain, you just raise your hand. Because some patients have very traumatic experience. Even if the patient is telling pain, the doctor will be keep the hands down. It will be like that only. So when the patient go through that experience and they are coming here, so you have to comfort the patient. They will come to the relaxed mode. One patient yesterday, consultation patient, 35 years back she went for a molar extraction. 35. Now she is 50 around. Almost all the teeth are gone. Only few teeth are mobile teeth are there. When the patient went to a dentist 35 years back, she went for a molar extraction. It was a very traumatic experience. The doctor pulled the tooth with the pain. Even when the patient is telling pain, it will be like that only. So after that, she didn't went to any doctor. She is extremely fearful now also. Now we suggested obviously full mouth rehabilitation. See, one bad experience if you give the patient, you are preparing for full mouth 20-30 years after, he or she will never go to another dentist. She will think all dentists and dentists will be like this. You are instilling a fear in the subconscious mind of the patient deep. So patient will be coming with those past bad experiences, right? So you have to comfort words you have to give. From the heart you should tell that, not just plain words. You should really mean it when you tell we will take care. Okay, there won't be any pain, don't worry, we will do slowly. Raise your hand. If you are having any discomfort, raise your hand. If you tell this no, the patient will relax. Right? What is the fear is not only pain. If I am pain, whether the doctor will solve the pain and do, or with the pain the doctor will do. Because their past experience, even if I am having pain, the doctor is keep on doing it. But when you tell, if you are having discomfort, tell us, we will solve it and we will do it. So this simple dialogue and communication, speaking few minutes before starting the LA or before starting the procedure, it will calm the patient. Sometimes even if you tell comfort, the patient still will be restless. You have to communicate further and you have to do it. This is the communication skill. So this is communication technique to reduce the anxiety of the patient. So what is the medical way of reducing the anxiety? What is the medical management for reducing the anxiety?
Music. Yeah, medical medicine.
Yes,
Rest.
playing music. It's a distraction technique. It is not the actual reducing the fear and all. It is a distraction when we listen to some favorite music. Sometimes listening to music increases the stress to the patient. You may be putting the song you like, which is totally not liked by the patient. Sometimes patient openly tell doctor stop that music. So you should put music which is likable to the patient. You have to ask the patient what kind of music you like. You can play that. Sometimes what you people do is you put your favorite music and you push the patient to like that music. That is another stress. Apart from injection, apart from treatment stress, listening to a music which you are not like is a stress. It's a punishment kind of. Why you are giving to the patient? Okay. So music is another aspect. What is the medical management? Giving a anti-anxiety. Okay. See, sedative is sleeping. There are some medicines which reduces anxiety. Okay. Antidepressants. Okay. So if you give Restil 0.25, the stress gets relaxed. It's like taking alcohol. There is nothing different, I guess. Okay. The patient definitely will feel relaxed when you give anxiety or Restil. Out of all these things, Restil is good with the lesser side effects and a good effect. Okay. Sometimes patient starts sleeping. No, you can hear the noise. Whenever you are giving Restil, definitely pulse oximeter should be there, because when the patient goes into the slight sleeping mode, the tongue falls back, the airway is getting compromised. So whenever the patient feels sleepy, I will again and again wake up. I will allow 2 or 3 minutes sleeping, then again, no, are you okay, sir? Open wide, something. Are you awake? Are you sleeping? Some dialogue you have to speak and keep the patient little bit conscious again and again. Don't forget to give the rest, because one day you didn't give rest, right? The patient was continuously restless. When the patient is restless, the patient's BP is increases, the blood pressure increases. You will see increased bleeding during sleep. That is why I asked, have you given rest? How I found out is the bleeding was more than usual. When the patient is restless, when the patient is very much tensed, the bleeding will be little bit more than usual. If he is relaxed, the bleeding will come down. See, the stress and anxiety, even though you cannot see them as solid objects, right? A knife you can see, you know it will hurt, but fear, anxiety, stress you cannot see, but it hurts more than a knife, right? It produces changes inside the body. So music and giving, see, Restil you don't have to give for all patients. For full mouth rehabilitation you can give for all patients, because it's a long procedure. Okay, stressful procedure. It is a kind of oral sedation. Instead of doing IV sedation, you are giving oral sedations. In many centers they are giving oral sedation, no, for all implant surgery patients. Whenever you are giving sedation, you have to ask medical history. If the patient is already taking any sleeping medicine regularly, if the patient is already taking medicine regularly, if you give 0.5, it won't work. Okay. So 0.25 is a safe range. Never give 0.5. Okay. If the patient is taking any psychiatric medicines already, then you have to think, you have to give some medical opinion. You can ask our anesthetist, sir, the patient is already taking these psychiatric medicines, can we give a rest? So you can get a medical opinion, then you can give. Don't give resting for all patients.